So the most important thing to do is mark the incision point. Vital importance is if it's too high up, this is when you can go through the retroperitoneum and damage ureters. So we've got to make sure we're going into the abdomen, into the peritoneum. Now ureters run, the lumbar finishes about there, and this is where ureters will run here, just below the lumbar. So we've got to make sure we're at least a finger away from the lumbar, or our incision point, because this is where ureter land is. Now cranial caudal, the further you go that way, the easier it is for the ovaries. The further you go that way, the easier is for bifurcation. But generally, feel the femoral head, that'll bring you to the front of the pelvis. An adult cat go about a finger in front of the pelvis. Medium-sized cat, a small finger, and then really small cat, just a little bit in front. So this is our line down, and we can't go past that line there. So we do a diagonal incision about there. It roughly works down halfway down the cat, so you should have an idea that it looks about right. If you're up here, obviously, that's scary. That's over the vertebra. You've got to make sure you're about halfway down the cat. Like I say, that's where the ureters are, finger below the lumbar, so that should keep us safe. So make sure we don't move the skin, but you can just press and keep the skin in the same spot while you do your incision. We don't want anything too big. Ideally just something to get the forceps through. So if we go with that. So we've gone through the skin. Next layer is the actual fat. Very variable, but one mistake, which is quite common, is to actually damage the external muscle when you're cutting out the fat pad. So the best way to go around that is to just snip into your fat as if it was muscle, and then just blunt dissect down to the muscle. Now if it was wrong and it was actually muscle, I'd be okay because I snipped it like it would muscle, so it's quite good doing it that way. And then now you can just trim away the fat. So we want a nice clear window, or you can see the muscle without the fat encroaching in much. So often bleeds. So we'll pick up our external. That's where we want the snip to be, then the external. So to achieve that, we have to hold it to the left. And then we'll just do our snip through the external. So next is the internal, which is thicker because it's made up of two muscle bodies. So we'll raise that up through the external, again holding it to the left. And sometimes I'll use iris scissors because they sort of cut cleaner and tend to go through the peritoneum better. So make sure if you're using those, make sure you tent it up. But it does help regards the peritoneum. So now we'll just hold on to the external muscle and we'll just go down and see what we've got. And that just looks like a blob of fat. So that could be the lumbar fat pad. If it is, the uterus will be just below it. There's a lot of fat. There it is there. Wow. Besides that, lumbar fat pad is massive. So let's just push that massive lumbar fat pad back in. And then just for comparison, that's your mesenteric fat. See how stringy it is. So your uterus sits between the stringy mesenteric and the big lumbar fat pad there. So once you find that, you know you can find it because it's just below it. And if you have got intestine there, it's above the intestine as well. Okay, so we're going to do the nice quick technique. Get some gentle mosquitoes. Push down, just do one click. I've done this thousands of times, I've never known the mosquitoes break their own pedicle. Touch wood. so we use Alice tissue to stretch it out. Now we'll just do a surgeon's. I'm using 2 metric 3/0 multi-filament. So ligatures on. Now we'll just place our clamp behind the ovary and take that off. And obviously we want to make sure we've cleared all the ovary and we've got some tissue behind the ligature. So you can see here we've got loads of exposure, so we'll just cut there. You can see there's no bleeding. So off she goes. Now we use this side of the uterus to find the other side. Any broad ligament you've got, just break it down because it'll help to exteriorise this side of the uterus more. Now the best instrument to find is the hockey forceps, the curved dissection forceps. And basically you're parting the fat here, because this will be running there, going down here, and then somewhere there's another one branching off, going that way. So we're looking down here. So we just lost power then for a minute, so hence the gap. Right, so I'm not sure how many throws we've done on this, so we'll just do a few more. Okay, so snip the tails, and you can see we've got lots of room. You can take that off, put that there if you want. Always put a clamp behind the over here, and we'll just snip that off, and then off she goes. Okay, so can we get to the body? Break a little bit of that broad ligament down there. And just about get to it, but not really. But because we can get to it close, I can actually ligate them close together. So just feed it up as much as we can. So it's the older cats you have to be careful with regards fragile uteruses. You can choose one. So I'll just pop one behind here, surgeons again. See the blanching. Okay. Let's take off our uterus. And now closure. I always close in internal muscle, external muscle, fat, and intradermals. I'll always do the muscle layers separate because they tend to be a different length. So if you do them together, it's going to mean you're going to leave a gap somewhere. So let's get our internal muscle up. So obviously that's the external. Tell a lie, that's the external, internal. There we go. So go through one side, we're going to do cruciate. Go through your other side. It's nice to do a chunky bite because there's less chance of tearing. And then you can use those two to lift this up. And now place the other side of the cruciate. So we want it snug together, but we don't want it super tight. Just want the muscle together. I'm using catgut here. If the catgut was breaking, then that's a sign you definitely are going too tight. And now we can leave that long tail on to then lift up the muscle again. See the muscle? So it helps you just raise it up. And then this should just close. With a second cruciate. Go to that tail, it'll just get in the way. Okay. So that's the internal done. External will just do exactly the same. Always looks a bit dog-eared when you close the external. Or is that because of my incision maybe? Okay, so again, just snug. And just need one more. I'll just do an interrupted. Like I say, the external never looks pretty when you close it, so it doesn't for me anyway. Okay, so the next layer we've got is the fat. The fat. So load up your needle holders ready, and then use 2 pairs of forceps to get the fat. Fat tends to go up here quite a bit. That's why you're best loading those up and using 2 forceps so you can get the fat. And we just want this closing, it's just closing the dead space. It's not a holding layer. So we just want to gently bring it together. So knot, and then I'll probably just do a couple of passes. One. 2. Tie that off. Get rid of the tail completely. And now we're going to our intradermals. So I tend to go in subdermal and try and just come out in intradermal position, just regards the knot, just sort of holds it down out of the place, out of the way. I always hold my needle quite close to the tip. I feel I have better control. They tell you to hold it back here, but to me it's just no control. If you're near the tip like that, makes life far much easier. Just checking we're not going through them coming out of the side on the skin. Oops, let's rethread that. It's a challenge without my glasses. Make a fresh tip. Okay, because it's 2 metric, we can tie it on. Over 2 metric, you can't really tie the knot on. Right, where were we? That side. So, coming towards the end now, so we want to try and leave a little hole where we can bury the knot. Looks okay there. I think that's got, let's just do another bite actually. You always want to leave a hole, but you don't want to leave too big a hole. See how sort of, because I've got that close to the tip, I can do a nice little bite. And we'll go with this. Okay, so take the needle off or leave it on, whichever. So that's where we start. We've got this loop. We grab hold of this piece and this becomes a new loop. And we tighten it by feeding it down like that. So again, grab that, becomes a new loop. Feed it down. Sure it stays nice and tight again. You'll get some cases more in dogs where it sort of bounces back, you'll tighten it and then it loosens off again. If that happens, the best thing to do is just put a rotation in, like that. So grab that, becomes a new piece, and just here, tightening it down. We'll go with that. Now recently it's been shown if you pass the end through twice, the Aberdeen's a lot more stable. So normally we just go through and pull it up. So what you want to do is go through once, go around, go through again, like that. And then just pull it up so it all stacks nicely. Now regards burial, the most important is to bury this knot, because if it sits there between the skin can't heal. And it'll dissolve away in 2-3 weeks and you'll get problems with the wound. So it's got to bury. The secret of bury is the passage of the needle. You want to keep it close to your knot. Basically probe your needle into an area where it just sort of glides through, like there. We glided through too easy. And if your needle glides through, you know your knot's going to bury. When you come to burying it, pull on the thread, but also use your forceps to pull on the skin. So it's a combination of the two. That's gone there. There you go. Sometimes it'll pull all the way through. Don't worry about it because you can soon sort it out. So nick the end off, and then you just lift up the skin, give it a jiggle, and there we go. So